Today we are going to know about the dengue fever. Dengue fever is a common fever caused by flavivirus in Asian region, and there will be some clinical features which are the incubation period. It's about 2 to 7 days, and there are two types: classical dengue fever and dengue hemorrhagic fever. First we'll discuss about classical dengue fever. Normally there is an abrupt onset of fever, malaise, headache, facial flushing, retrobulbar pain, which worsening of the eye movements, and there will be conjunctival suffusion and severe headache. There will be lymphadenopathy and petachia, and there will be soft palate and skin rashes may be also occur, and there will be some limp, and there is a rash of the treatment of which appears on the limbs and then spreads to involve the trunk. But the cough is uncommon in dengue fever, and the fever subsides after 3 to 4 days, and temperature returns to normal for a couple of days, and there will be a fever returns, and the biphasico saddleback pattern has considered as a characteristic feature of dengue fever, and there will be severe fatigue, and unwell and depression are common in several weeks after the fever has subsides. Now we'll talk about the dengue hemorrhagic fever, and there will be a mild start with upper respiratory tract infection, and there will be followed by abrupt onset of shock and hemorrhagic into the skin and ear, which called epistaxis, and there will be a hematemesis and melena, known as the dengue shock syndrome, and there will be severe complement levels are depressed, and there will be consumptive coagulopathy. Now we are going to discuss about the clinical features of the dengue fever. There will be 2 days of malaise and headache, and there will be acute onset of fever, backache, and there will be generalized pains, and there will be pain on eye movement, and there will be anorexia, nausea, vomiting, and there will be relative bradycardia, and there can be lymphadenopathy also, and we'll talk about the fever, which is continuous and saddleback, which breaks on 4th to 5th day, usually last 7 to 8 days, and there can be a rash on the patient. Now we are going to talk about the investigations. In blood investigations, there will be thrombocytopenia is a common thing, which means there will be very low platelet level, and count is less than 50,000. Dengue hemorrhagic fever is very common with leukopenia, and the virus can be recovered from the blood, and there are tests to viral antigen also. Management: there is no specific treatment. Several pains can be relieved by paracetamol or the Panadol, and occasionally opiates are required for advanced level of pain, and we can do the volume replacement, and if it's needed, we can do for the blood transfusion also, and a patient can be nursed under a mosquito net and aspirin is need to be avoided, and corticosteroid has not been shown to help, and no existing antivirals are effective for this kind of condition. Thank you very much.